Where is the first line? Could I have the first line? Am I supposed to push on that?
The first slide, please.
But they don't seem to understand. They told me to push on that.
Ah, there we go.
Oh, here. Oh, this is the second one. Could I have the first one, please? This is not the first. This is number God knows what. Okay, please go back to the first one. Now I can see it here. Good. So my job is to sort of restitute a 5-hour discussion that involved all these people who are here. And the discussion was organized by Isabelle Soja-Mataram, who's here from IARC. So we all agreed that it's important. Could I have the second slide? It's important when thinking in terms of prevention to have an order of magnitude of the risks. And this is for France. And you have on top the substances that are certainly carcinogenic for men, and at the bottom things that are probably carcinogenic. And the size of the circles is an estimation of the number of cases attributable to each cause. So you can see that in France, the two main causes of cancer are tobacco and alcohol. The reason why alcohol is so important in France is just that the consumption of alcohol is very high. It was much higher at the end of World War II, and it's been going down, but it's still extraordinarily high. If you take the amount of alcohol that is drunk in France and you spread it evenly on the total population age 15 or over, you get 2.6 drinks per day. One drink here is 10 grams of pure alcohol. 10 grams of pure alcohol is what you get when you ask for a drink in a bar, not what you pour yourself at home, because you can put a lot more whiskey than the shot that you will be delivered in a standard drink on a bar. So the consumption of alcohol is very high, and the consequences is a very large number of cancer, including breast cancer. It's actually the main cause of breast cancer in France. And then the other causes have been mentioned. Some of them have been mentioned already: infection, physical inactivity, obesity and overweight, ultraviolet exposure, hormonal treatment, etc. So you have to have that in mind. You think in terms of prevention, reducing the amount of salt, for instance, or indoor radon in non-smokers is not going to be as efficient as working on alcohol or on tobacco. Next slide. So what's important is to think in terms of policy. The general public have a vague idea of the European Code against cancer, but what should be done in terms of policy? So the first thing, ideally, would be to use legislation, pricing, and other policies to promote healthy living. And it's very hard to say in France that no alcohol is the best anti-cancer prevention. Nobody wants to hear that, but this is just the truth. That's what the evidence tells us. And how can we promote healthy weight and food choices? And there are discussions right now with the food industry, and the discussions are being very complicated because the food industry doesn't want informative labeling of the food. The next slide insists on the very important and very effective way to reduce consumption of tobacco and alcohol is to increase the price through increasing the taxes. This works, and it particularly protects poor people and young people. And unfortunately, in France, that hasn't been done for about 10 years. So we do have a big problem. This is part of the Framework Convention on Tobacco Control. It has been ratified by France, among other countries, but the government doesn't seem to realize that they have signed that convention, and they just don't do it. We've talked about HPV and Hep B vaccination programs. The French coverage is very bad. And screening programs should be monitored, and one should avoid screening when net benefits is not demonstrated. Whether prostate cancer will prove eventually to be beneficial or not, we don't know, but for the time being, it's not recommended. Occupational and environmental carcinogens should be reduced, so there should be legislation. And it's very important to monitor the interventions and to publicize the results. Everybody should be able to know what the coverage of screening for breast cancer in a given country, etc. And this is an ongoing, regular review of the evidence. And last slide. Risk factors should be monitored. What's the prevalence of smoking? How much people drink? If you want to know the consumption of alcohol in a country, and you interview people, even if you interview a representative sample of the population, you get something that has to be multiplied by more than 2, closer to 3, to explain the amount of alcohol which is marketed. So you have to reconciliate the sales data and the survey data. Otherwise, you get a very wrong idea of things. And the last but not least thing is to ensure no interference from lobbies when formulating health policy. And in France, the tobacco lobby was in the parliament when they were voting plain packaging, and they write the amendments. They do the writing of the amendments for the representatives. You can see that several representatives are advocating exactly the same, with the same wording, something that has been written by the tobacco industry. Same thing with alcohol. The alcohol lobbies are very powerful. And the food industry also is right now trying to keep informative labelings out of food packaging. So I'll stop here.
Yeah, well, thank you very much for the summary. I heard it was quite the extensive workshop, and I wanted to ask you a bit, like you're highlighting the tobacco, and there is a bit of a mixed relationship with tobacco, because it's very clear this causes lung cancer, and it's very clear if you tax it, people do buy less of it. But I was struck yesterday when I was sat on the airplane, and I go to the last page of my shopping, and I can buy all these cigarettes duty-free. Like, I can skirt that tax, and if I really want to smoke, I can kind of not pay the higher price. I was wondering if you could talk a bit about policies that might be more consistent, or or a desire for more consistency, I guess. Well, I mean, is perhaps maybe bypassing industry and going right to the public and making the picture much clearer for them one way of going about it?
Well, in a sort of paradoxical way, plain packaging will make the picture clearer because there will be only negative messages on the packages. The other thing about it's an industry argument that if you increase the price, there will be more smuggling and more, and it's very interesting because actually, for instance, in France, it's estimated that about 20% of the market is tax-free tobacco. Mm-hmm. And this 20% is 15% cross-border buying. So if we had a consistent pricing policy within Europe, we wouldn't have that problem. Cigarettes are cheaper in Spain, they're cheaper in Belgium, they're much cheaper in Luxembourg. The Luxembourg are just making a lot of money by selling cheap cigarettes to neighboring country, and this is really very bad behavior. So it's 15% cross-border and 5% smuggling, and the smuggling is organized by the industry, and it's being discussed labeling of the packaging that allows identifying the source of the package, you know, why does it come from Ukraine where the taxes are very low and it arrives tax-free, quote unquote tax-free on the French market. This is all organized by the tobacco industry, and I think they were planning more or less to let the tobacco industry be in charge of this labeling, and that's not the right way to do it. Of course, you don't ask the smugglers to.
Clearly a conflict of interest.
Absolutely.
Yeah. Oh, sure.
I have seen a lot of the factors that we are discussing every day. One that I couldn't retrieve on your slide was, why not education? Why not start with the young and actually put all those risk factors into comprehensive educational programs?
It's a very good idea, but you know, teenagers, what they like to do is just what the grown-ups tell them not to do. So, and they know, they have the information. But it's true, there's a big problem with education. Right now, because of the security in France, they are letting high school kids smoke in the schools, which is forbidden by law, just because they think it's dangerous to let them, because they used to sneak out and smoke on the pavement. So yeah, there's a space for education, but I'm afraid it's the grown-ups that have to be educated, and the head of the schools should know better.
I'm thinking more at 5 years old than 15 years old.
5-year-olds, they all think tobacco stinks, but 13-year-olds, they will try their first cigarettes.